If reflux occurs during sleep, we do not have the normal mechanisms available to us to produce normal acid clearance unless, in fact, there is an awakening from sleep.
In fact, delayed clearance during sleep is when injury to the esophagus is most likely to occur. At Baptist Medical Center in Oklahoma City, Dr. William Orr and his sleep clinic team are studying the incidence and effects of nocturnal episodes of gastroesophageal reflux disease, or GERD.
The frequency of swallowing is markedly reduced during sleep. And we also know, for example, that salivary flow is negligible, if not completely eradicated during sleep. In addition to that, these individuals very commonly have poor peristalsis, that is, the amplitude of the peristaltic contraction is diminished.
Incompetence of the lower esophageal sphincter, or LES, manifests itself in two main ways: transient relaxations and diminished basal LES tone, both of which contribute to the frequency of reflux episodes and the amount of refluxate.
It's coming out of that. It's still no clearance. We've still got a prolonged episode of reflux here. If individuals do not awaken, what we find is that the acid contact time can last up to 45 minutes or an hour, and this is an extremely deleterious situation in terms of producing damage to the esophageal mucosa. This suggested that the occurrence of nocturnal gastroesophageal reflux was very important in the development of the complications of this disease.
The observations of Dr. Orr's team supported earlier findings about the role of arousal mechanisms.
While sleep impairs clearance in patients with symptoms of nocturnal heartburn, waking from sleep may actually promote acid clearance, suggesting that nocturnal symptoms may actually be protective in nature.
Many physicians, concerned about the intrusive awakenings that deprive their patients of restful sleep, respond by prescribing sleep medications. Unfortunately, this sedating effect may actually suppress arousal mechanisms, resulting in more prolonged reflux clearance times, potentially harmful for GERD patients.